right. Well, our session today is brief, so let's dive right into the data. As I mentioned before, my name's Ann Lally. Seen me around the summit. I'm here with my colleague, Leah Vermont. We both work in the Community Health Intervention Lab in the Department of Community Health and Health Behavior at the University at Buffalo, part of the Veggie Van study team, along with a variety of other mobile market projects that the Veggie Van study team is involved in. So the reason for our presentation today is to present some of our initial data collected in our impact of COVID-19 on mobile markets in 2020 snapshot survey. You may have received notification, I hope you received notification to complete the survey over the past week or so. And we are going to present on our preliminary data. And this data will inform our next survey, which will be a more complete mobile market survey for the year 2020. But again, we just wanted to get some preliminary findings on the impact of COVID-19 on mobile markets last year. And just some housekeeping too, if you have any questions on specific slides, feel free to throw it in the Q&A portion of the chat, or I'm sorry, Q&A portion of Zoom. We'll also monitor the chat, but Q&A is easier just to look at on the fly. And we'll try to answer your questions on demand on the slide that we're looking at. And we'll also have a couple minutes at the end to field any additional questions. So without further ado.
All right, thanks, Ann. So as Ann was saying, this is just a very small sample from folks that took the survey. So we're looking at an N of 51. From that, we're seeing that respondents were mainly from California, New York, but represented across the state. You can see in the shades of blue. I wanted to use this time, though, to talk more generally about, our bigger picture of trying to map and know where all of our mobile markets are. I know there's been some discussion in the mobile market listserv. Pam shared some resources, as did Matt. He was putting together a map. And so that is something that we are continuously trying to work on and have as part of our toolkit. So we will have I think we have about 70 right now total actual mobile markets or organizations that are currently running a mobile market. And the ultimate goal is to utilize or incorporate GIS. And so, I'm just reading the chat. I do think that you're all muted, yes. And so the idea being that it's a tool for operators, funders, to go in and identify, where are mobile markets across the U.S., where are those gaps in services? Just wanted to plug that and give an overview of that.
If there's any issues with feedback, it might be me. Is that the issue? Leah, does it sound okay to you? Okay, good. Any issues if you're asking about, that in the chat about being muted, just let me know if you're having a hard time understanding me. Stephanie is asking about being added to the listserv. The easiest way, Leah, do you want to?
Yeah, we'll send instructions through the chat on how you can access that.
Mm-hmm. Great. So just to start with some of the data, right? We just wanted to know where individual markets we're serving. So you'll see our counts up here. We had 51 people come into the survey, and then the answers are anywhere from 38, 39 about. Some skip because they did not operate a market in 2020. So the majority of markets are urban. And we also see 34% in rural areas and then 39.47% in suburban areas. And I'm sorry, there we go. My dashboard is blocking my slides. So since the start of the COVID-19 pandemic, how has the demand for a mobile market program from customers changed, right? Overall, we're seeing either more of a demand or about the same demand for a mobile market. And that was kind of to be expected, I would say. Very few with seeing less of a demand. That was something that came up in our COVID-19 open calls that we were hosting in the beginning of the pandemic. Was, there's all this demand for mobile markets to kind of function to fill some of the gaps in the food system that were being exposed through the pandemic, and then just finding the ways to, again, fill those gaps and be most effective within that context. And since the start of the COVID-19 pandemic, how has the demand from community partners changed? So the first slide was from customers themselves, community members, and then community partners. So these would be the organizations that mobile markets partner with to host sites. And again, more of a demand for mobile markets, or at least the same demand.
So an increase in demand involved program pivots, new barriers, and a greater interest in free options. So this is some of the quality data that we've gathered. You can read through this. So we pivoted from a shop at market to delivery of boxes of produce, which were paid for by COVID relief grant funds. Folks are seeing more of a demand for free food programs, which we're also doing temporarily as a mobile market. We're seeing more of a demand, but due to limitations of being in buildings, we're limited to serve as we did in recent years. And about the same, but a new set of customers, while a previous regulars have dropped off. So that's interesting to see that there are some of these new customers. We've actually heard from other people in different contexts that it's been those regular customers that stayed on with them, and they've actually had trouble building trust with new customers. So we're also seeing a different kind of demand for what we can and should do. There's lots of interest from food pantries, and that's just not something we've experienced in prior to COVID.
So we were thinking, as we were reviewing the data, what types of partners have expressed greater demand for your mobile market? This is a question we had when, again, reviewing the data, and something that we want to pursue in our future survey. But if anyone wants to pop in the chat, the types of partners that you've had say, okay, we need you to come out. We want to host a mobile market at our site. We need this service within our community, whether it's, a community center, a church, a school, any other types of venues for a mobile market that are maybe new to you because of the pandemic. Let's see what we've got in the chat. Head Start in schools, government housing and food share, senior housing. Yeah, we heard that a lot in terms of senior housing. There was a great need, obviously, because seniors were the most strict in terms of lockdown protocols and social distancing protocols. But then also finding a creative way to be able to serve seniors in that context in a no contact way. Food prescription programs, says Lainey, Jennifer, healthcare centers, Price said senior housing. Yeah, direct sales to homes. Great, thank you guys. And I will, continue to drop these into the chat, and we can review them a little bit later as well. So 61% of respondents operated for the same or greater season length as compared to 2019, and even 4 markets actually started in 2020, which is, an optimistic statistic for the time period. So many markets felt, that they were unable to stay open or had to reduce their season. But on the flip side of that, some markets were able to extend their season due to need, and then also some markets started new in 2020. And I think Leah and I were talking about this yesterday, that it also has to do on where these markets were located. And also, as the waves of the pandemic kind of went through the nation, some seasons were cut short because that's when the pandemic kind of hit their area hardest was later in the year, October, November. Some started late and on our end in New York State and the Northeast, because that's kind of where we were when we were hit the hardest. So I think there's some variability there as well. And number of sites changing between 2020 to 2019. We heard that a lot of markets did visit less sites, so we're a little bit surprised to see that others had visited more sites, kind of even Stevens on that stat. Anecdotally, in our COVID-19 calls, a lot of market operators had reported that they were visiting fewer sites, but possibly more often, just because of the length of time necessary to host a market. Whether, before you could show up and be set up in 20 minutes, now it took you an hour and 20 minutes to set up. So fewer sites possibly. And when it came to reducing the number of sites that markets operated at, to prioritize the sites that they were going to visit, it was really about access as well as community demand. Those were the two highest numbers. Access being like, could you even physically access the space? Did the school close down? Did the community center close down because of the pandemic? And then community demand as well. Are you having customers come to your market? Others used food insecurity data, income data, and then others were the NAs that they didn't have to reduce.
So the ability to follow social distancing guidelines was a major factor in prioritizing certain sites over others, which makes sense. Again, just some of the qualitative quotes we've pulled. The physical space could be set up in a safe, socially distant market for stops where the space is restricted. We often did pre-order service, work in partnership with community partners, resource centers, health providers, and didn't visit a couple sites due to their decrease in programming. So that was, again, time and again, you're seeing, you're relying on your partners, and it depends on what's happening with them. So presence of staff on site to get the information out to residents regarding our mobile markets. We were talking about that before in terms of, we rely on these site partners to know what's going on and being able to provide that communication on the ground. And if they're not there, like, what does that mean for community engagement? It can be really tough. Still serviced same locations, but instead of a full service market at 4 of the locations, we did a pre-order pickup only model to safely serve when there was not enough room to abide by restrictions. So again, you changing up, kind of going back to some of the slides regarding like site changes, you're shifting the model to accommodate the staff that you currently have, and how can you spread that out over various sites or change up the sites to accommodate that. We first prioritized our existing partnerships for site locations and didn't do as many pilot markets at new locations as we've done in the past.
So one of our questions was on sales generated. And the majority of respondents said that there was less revenue during June, July, and August of 2020 as compared to the same months in 2019. But then also 25% saw more revenue. The less revenue, there's some nuance there, and you can see that in some of our qualitative responses. And we'll touch on those in a second. But so which actions have led to lost revenue? Again, 42% that said that it was not applicable, but 20% said a decreased customer attendance, and then the others were really where we saw the majority of our responses. So I'll advance to that.
So lowering prices or offering free options along with logistic issues contributed to decreased revenue. So we're seeing decreased price per pound sold, having fewer markets. Had to open them later due to COVID, switch locations. New bus was being built and took longer to complete. So Fred was talking about that with some of his operations, just the supply chain, right, is being affected. So it has this downstream effect. We had to increase the number of staff at each site. So we had to dramatically decrease the number of sites. So there's a lot of resources that are needed to implement all of these protocols, which again is resource intensive. We pivoted to a free distribution model during those months and fewer full service stops, which is again something we've seen consistently. Change in city benefits program. And this too, we've seen a lot. SNAP sales increased in aggregate and the average SNAP sale doubled. So again, huge point there that we'll cover or we'll see play out in the data.
So in terms of actions kind of offset that lost revenue, we're seeing, again, the NA being the first, the green zone, but then yellow, the 16 being submitting new grant proposals was the most significant. And we can make all this data available after our presentation. Just for the sake of brevity, I'm going to cruise through some of these questions.
So revenue loss was balanced by reduced expenditures for some, while others found new sources of revenue. So creating CSA, again, changing up how staff are used, financial donations from community partners, foundations. We've seen that mentioned throughout, that just the general funding coming from county, state, federal level, healthcare incentive programs, and home deliveries.
And the majority of markets increased the volume of produce that they distributed. And this is whether for sale or for donation or totally for free. So this was a major piece of the puzzle, right, when it comes to increasing access during the pandemic, that mobile markets were able to increase the volume of food distributed between 2019 and 2020, despite any barriers being faced by markets. That brings us to the USDA Farmers to Families Food Box Program, which we've talked about in some of our other sessions, some of the flaws with the program itself. However, in spite of that, I think it's an important thing to highlight that mobile markets were able to kind of fill that void, and we're able to pick that baton up, let's say, and be able to distribute the farmers to family food boxes. Some were able to serve as aggregators, but for the most part, it was focused on distribution, either through their market sites or in another way. I've heard of some markets actually implementing some delivery services as well. And then again, an increase in use of fruit and vegetable incentive programs, a big increase of SNAP matching program, and SNAP itself, including the pandemic EBT, makes sense. But overall, we're seeing an increase in the use of incentive programs. And an interesting note that Leah and I had seen in the data was that the fact that 14% of our respondents did not offer these incentive programs. And this is something that we are focusing on moving forward with the development of our mobile market coalition, is being able to offer kind of standardized services for designing and offering incentive programs at mobile markets.
Yeah, and I was just wondering, what time are we until?
We're until 3:20. We have a break from 3:20 to 3:30, so we can kind of cruise through these slides and finish up in the next 5.
Yeah, so again, I think although most saw an increase, some markets saw a decrease in SNAP usage, citing accessibility as a contributing factor. So we accept SNAP and have a matching program, and while they were used, there was not a year-over-year increase in use. We did not see an increase. And so I think that that's, again, goes back to Anne's point. There's some barriers there that, we don't necessarily know exactly what that is, but it's interesting and will be important for us to dig down and see what was causing those barriers when generally we are seeing an increase in SNAP overall.
So this is something that really came out as a result of the pandemic, right? Pre-orders or prepayments at the market. We expected a larger number on this, but a third said that this is something new that they offered due to the pandemic. talking a little bit about online orders. Again, a third of those respondents that said that they did offer these orders are doing online. Very few are doing phone-based. And there was really not a consensus on any specific platform for online ordering. You'll see Square, Local Line, Farmers Register, and then Clover was a little bit lower. These are all just singular counts. So the most utilized being Shopify, small numbers. But again, there was no real consensus on these platforms. And kind of along those same lines, there was no, consensus on being super satisfied, somewhat dissatisfied, had, the cumulative largest piece of the pie, very satisfied, about a third of respondents. So this is, again, another gap that we're kind of identifying in that online ordering world.
And I'll
barriers.
just say real quick that
Yep.
We're going to be relaunching our webinar series that Anne was leading last year. That will likely be our first webinar that we're putting on probably at the end of the month. I think that a lot of partners that I've talked to have been, they're trying different, they're cycling through some of this stuff. And so we'll hopefully try and do like a panel to get people's input of what they're currently using.
Lainey has an interesting question in the chat too. SNAP has conveyed to us that we can only use if we have a map of routes. Is that something that others have created and constantly update as stops change? I personally, have you heard of that with our partners, Leah? The need for a map of routes? If anyone else wants to jump in the chat with Lainey, I'm not, delivery areas, says Lucia. Yeah. So in terms of barriers, it was mainly others, we saw for the most part between federal level policies and local policies and funding, it was more at the local level that individuals experienced barriers to the local funding and policies.
Yeah, I think we can skip.
Yep. Just a little bit more on these barriers, logistic related. This was really stuck out to me. I'll just mention it. Customer experience and needs were really transformed by pandemic restrictions. This is it's a little obvious, but to read these qualitative accounts is important, I think. And then information gathering during the pandemic, public health departments, local food access groups, mobile market network listserv, and then the personal network of other mobile markets that individuals knew, other operators. So really that community piece between mobile markets and then also local resources. And then this is kind of a hand-coded question, this idea of operational pivots or adaptations that were implemented that will become long-term or permanent features of markets. So the most important or most prevalent innovation or pivot was prepackaged and bundled food boxes. The most respondents say had adopted that and will continue to make this a feature of their market, followed by online or pre-ordering, and then general COVID-19 safety protocols. Deliveries were also on there, but I think logistically they're just more difficult, so not as prevalent. And then again, just some qualitative notes about bundling and box models, that this was, the most common operational pivot that markets are planning to maintain. This is something that is highlighted also in our VeggieVan toolkit, the bundling model. And for the sake of time, I just want to remind everyone to join us for our next presentation at 3:30. Leah, we can dip into the chat real quick if you'd like.
Yep, I'm not seeing anything new coming in.
Okay, great. Yep, just some responses for Lainey. Great. Well, if there's a Q&A. So Lainey asked in the Q&A, same question that everyone's kind of responding to. All right, great. Well, thank you, everybody. And we hope that you'll join us for Lindsay Haynes Maslow's talk on food assistance program policy updates during the pandemic. And that link I will put into the chat, and we will see you over there. Thank you.
And what time should I go on to this, our next one? Again, like 10 minutes before?
Yep.